Hello, everyone, and thank you for joining us today. I'm here with Jill Hunsaker Ryan, the Executive Director of the Department of Public Health and Environment, and Rick Palacio, who is our strategic advisor in my office, spearheading efforts to get the vaccine out effectively as well as equitably across our entire state geographically. Today, they're going to share more information about how we're working to ensure that Coloradans in every corner of our state, particularly right now, those 70 and older, can have access to the life-saving vaccine. First, I want to provide an update on today's COVID numbers: 1,798 new positive cases. There's 772 people hospitalized from COVID across our state. Those numbers have been relatively stable for the last few weeks. It just shows that until there's enough time for the vaccine to protect enough Coloradans, we really need to be vigilant, wear masks around others, reduce social interactions, and try to keep a distance whenever you are interacting with others. We need to get through these next few weeks and months. Right now, just over 6% of the population of our state has received at least the first vaccine, is on that clock towards immunity, and more in the coming days and weeks. The vaccine is here, and every day more and more people will gain protection, but this is why we really need to double down on protecting people. Each week we use every vaccine that we get. We also took the steps to go to real-time inventory management to make sure that no dose is idle. But in order to vaccinate more people, we need more vaccines, and we depend entirely on the federal government for the weekly supply. We want a vaccine for every Coloradan right now, but to put things in perspective, we're expecting about 83,000 next week. There's 5.7 million Coloradans. So that's a lot of Coloradans who want the vaccine, but won't be able to get it next week because we get 83,000. Now, we're hopeful that those number of vaccines will increase in the coming weeks. It'll probably be around 83,000 for about 2 weeks is our best estimate. Then we're hoping for a modest increase. We hope for more than a modest increase, but we understand what will likely be a modest increase, maybe to the 110,000 a week range. And then, of course, we're also hopeful that at some point the Johnson & Johnson or AstraZeneca vaccines will be approved, unlocking new supply to more quickly end the pandemic. I know there's some confusion, so I want to walk you through, if you are over 70, have friends, parents, aunts, and uncles over 70, exactly how you get the vaccine. It's very simple. Phone numbers, if you can sign up online, you do that. If you don't have a computer, don't have access, easy to access phone numbers. I'll give you all of those. We want to try to make it as easy as possible. You can always get up-to-date information at covid19.colorado.gov, and then click on the vaccine providers list. And I want to thank all of the providers we partnered with. It's just been so impressed to see our hospitals, our community health clinics, some county health departments really rise up to this challenge and say, we are ready, right? And these are hospital networks like UC Health, Centura, others, and they're saying, you know what, it's everybody. It doesn't matter if you're our customer, it doesn't matter if you're insured. We need to do this because we are part of the community, and this is the most important, urgent thing that we can do. And they've really stepped up at great expense to really take this on, and I just want to thank all of those partners. I want to encourage everyone who does have access to a computer to sign up online. It is easier and quicker, but I know, especially people over 70, there might be some people watching this that don't really trust themselves around computers or don't rely on internet, and so all of our major provider partners have now set up phone numbers, toll-free phone numbers, where you can sign up as well. So Denver Health, if you have a computer, denverhealth.org/COVID vaccine. If you want to call to be on the list, 303-436-7000. Centura Health, with many locations across the state, English and Espanol, toll free, 866-414-1562, or you can visit centura.org/vaccine and sign up for the vaccine notification sign up. UC Health, with locations across the state, uchealth.org/COVID vaccine. If you want to phone them, it's 720-462-2255. That's during business hours. They're able to staff that 7 a.m. to 6 p.m. And I want to thank UC Health. UC Health has administered more than 72,000 doses of COVID-19 vaccine, and they vaccinated more than 23,000 people 70 and older. Remember, they first were doing their own staff and doctors and nurses that are around COVID patients. including thousands that have never even been UC Health patients. Remember, you can pick a provider near you. It doesn't matter if they're in network, if you've been there before, sign up and it will be randomized when you're selected. And if you are 70 and up, some will get called this week, some next week, some the week after. You will get the opportunity to get the vaccine. Just with those numbers that we articulated, we get 83,000 vaccines next week. State of 5.7 million people. There's 530,000 people over the age of 70. Everybody who wants it, just simply by the mathematical numbers, can't possibly get it in 1 week, but you will be on those lists. Go ahead and sign up. UC Health added 40 staff members just to help staff that phone line that you can call 720-462-2255. Kaiser Permanente, serving members and non-members, kp.org/COVID vaccine/Colorado. They're still working on getting their public phone number set up. I think it'll be available soon. Boulder Community Health, 303-415-7777, or you can visit bch.org. Vail Health, vailhealth.org/COVID-19/vaccines. You can also call them at 970-328-9750. SCL Health, with a number of locations. If you're not currently an SCL Health patient, you can sign up to get the vaccine on the website, sclhealth.org/COVID vaccine, or call 833-762-0141. And then you'll be notified on a randomized basis when you're eligible for those who are 70 and up. Health One is now begun to offer the vaccines to members of the public over 70 as well. www.healthonekares.com/vaccine. If you want to call Health One, it's 303-453-2477. You'll be instructed to leave a message with your name, date of birth, phone number, and you'll get a call back within 5 business days is what Health One is indicating. It's also English or Espanol at Health One. Salud Family Health Centers, community health centers, saludclinic.org for more information. They'll have a phone number soon as well. So to see all these in your area, go to covid19.colorado.gov, click on list of providers, and simply pick one that is convenient to you and sign up. You might get the call tomorrow. You might get the call in a week or 2 weeks or 3 weeks. You will have the opportunity, if you are 70 up, to get the vaccine in the next few weeks. And of course, we shortly thereafter hope to expand eligibility. More information on that next week. Since we received our very first dose of vaccine back in mid-December, we've really been focused on a way that makes sure that we're equitable across our state, saving the most lives, ending the public health crisis as quickly as possible. That's why the focus on 70 and up, representing 78% of the fatalities that Colorado has experienced from COVID-19, and over 40% of the hospitalizations. That's why it's key from the start as well that Coloradans don't need to be a member or have in their plan any of the wherever you go. You can go to whatever is convenient to you. And that's why we're making a deliberate effort to really meet Coloradans in communities where they live. We partnered with community organizations already to stand up drive-through community vaccination clinics in San Luis Center, Alamosa, Aurora, Denver. We're going to do more and more. Rick and Jill will talk about that effort to supplement the community health clinics and the hospitals and the pharmacies to be in areas that are medically underserved to make sure that everyone has access to this life-saving vaccine. We've made sure that health insurance status, ability to present a photo ID play no role in getting the vaccine. The fact is, the more Coloradans that get the vaccine, the better off we all are, the sooner this ends the pandemic. That's why we're going to do everything we can to break down barriers to access, no matter where you live, who you are, where you're from, what you do. We want to make sure you get the vaccine as quickly and efficiently as our supplies will allow. In order to do that, we've put together a really stellar team that I'm very proud of to lead our vaccine equity efforts. They're going above and beyond to make sure that no community is left behind, really augmenting existing work that CDPHE is doing to deal with these barriers in healthcare. I'd like to point out that Executive Director Jill Ryan started the very first equity office 20 years ago. at CDPHE, and it's only natural that now she is part of leading this effort. I'm proud to turn it over to Jill Hunsaker-Ryan and Rick Palacio to provide details on our efforts for geographic and access equity. Jill?
Thank you, Governor. I'm actually going to hand it off to Rick Palacio to begin.
Thanks, Jill. Thanks, Governor. Thanks, everyone, for joining us this afternoon. I want to introduce you to the Colorado COVID-19 vaccine outreach team, which is pictured here. Of course, it is headed up by our executive director for CDPHE, Jill Ryan. I serve on that team as well. The Honorable Elbra Wedgeworth, Nita Gonzalez, and Maisha Fields all serve as advisors to us in these efforts. And of course, we want to make sure that we're giving credit to the amazing staff at CDPHE that works under Jill for their years worth of leadership on this issue and helping to put together an amazing outreach plan so that we're not leaving anyone behind as we get vaccines into the arms of Coloradans. So I want to talk to you a little bit about our prioritization philosophy, especially as it comes to vaccine equity. We want to make sure that we're rapidly deploying the vaccine and we're focusing on equitable distribution. We know that especially communities of color and low-income communities have different health outcomes. So it's important that we get vaccines into those Coloradans as quickly as possible so that we're, again, not leaving people behind and we're saving lives. We need to end the crisis really that has been brought on by the pandemic. We know that this virus is probably going to be with us for some time, unfortunately, but it doesn't mean that it has to change our lives for a very long time. So we believe that getting vaccine into arms can really help to end that part of the crisis. So here are some goals that we've set out from the beginning of this operation. The governor believes that we set a very important, wildly important goal of vaccinating 70% of Coloradans ages 70 and up by 28th of February. Now that's a goal. I think it's very likely that we should be able to get to that before the 28th of February based upon our supply of vaccines that are coming into the state. But nonetheless, that is our goal that we're striving to achieve. So we've broken down the allocation of vaccines in this pie chart here. A vast majority of those vaccines, roughly 60%, are going to our large hospital systems, of which the governor mentioned at the beginning of the press conference, and also coming online are our retail pharmacies. We're also partnering with community partners and local public health authorities. So think your county health department will be receiving about 15% of our weekly allocation. 15% are going also to our critically important community health clinics. Upwards of 73% of Coloradans actually get their primary care, health care from our community health clinics. They play a vital role.
Thank you for watching Denver 7.
Communities of color as a whole. And then what Jill and I co-chair is the Governor's Equity Task Force, which is taking 10% of our weekly allocation to make sure that we are able to reach hard to reach places. So we've set a goal that we're going to set up a community-based clinic, a pop-up clinic in half of the top 50 census tracts for high density, low income minority communities. And of course, that's just a floor. We hope that we can reach as many of those top census tracts as possibly can. And of course, depending on the flow and supply of vaccines that are coming from the federal government. We want to talk a little bit about our equitable distribution strategies. As we mentioned, we couldn't do this without community partners. We have a tremendous number of partners that we have been working with for a very long time who really have an ability to reach into their own communities. So we'll be partnering with them. We want to make sure that we are increasing and improving and demystifying vaccine access so that there is less and less vaccine hesitancy. We want to make sure that our outreach opportunities and our outreach efforts are funded. And of course, we talked about the pop-up clinics and provider partnership, which are going to be critical to making sure that we reach these hard-to-reach communities as well. We'll be distributing vaccine to pharmacies in underserved communities in a way that is incredibly strategic so that they can hit their patient population a little bit broader and wider. And then the vaccine outreach team, which we talked about. And it's important that all of our communication be multilingual, and we are running efforts like that as well. And Jill will talk about some public health orders that require providers to make their best efforts to capture demographic data to better inform our efforts. So when we talk about expanding community partnerships, the governor mentioned a couple at the beginning of the call. We're very proud that some of the very first seniors in Colorado to receive the vaccine at the beginning of January are some of our seniors in San Luis. San Luis sits in the San Luis Valley, the southern edge of our state. There are only 644 people in the entire town, and through our community partners, over 200 seniors received their first dose of vaccine just in one Sunday afternoon. And here are just some other examples of pop-up clinics and partnerships that we put together. And we believe that there is no community partnership that can't help us to achieve these goals. So we're really eager to work with community groups across the state to help vaccinate more Coloradans. Here are some photographs of some of our initial pop-up clinics. The one on the left was in San Luis. I think it was 23 degrees on that Sunday afternoon, but nonetheless, the drive-up clinic was wildly successful. And on the right, some photos from Salud Family Health Center, which vaccinated their frontline staff as well as patients from their network as well. Jill?
Thank you, Rick. Good afternoon, everyone. So our decision making is really guided by data, and the first thing we did was take a map and really try to hotspot where the counties that have the highest percentage of people that have incomes below the poverty level, people of color, and this helps us really determine how we're going to concentrate our efforts. We have some tools that actually help us get down closer to the neighborhood level. And so we can look at available pharmacies in those areas, or even places that we're starting to call vaccine deserts, places where there aren't healthcare facilities. And so we may need to do some pop-up clinics. In terms of vaccine access and expanding accessibility, we do want everyone to know that the vaccine is free. And so income, health insurance, those should not be barriers to getting the vaccine. Everyone has access regardless of immunization status. We have sent a letter to providers telling them that they may not ask for or require, I should say, they can ask for, they can't require a driver's license. People do not have to have residency citizenship status in order to get a vaccine. That's really important because, again, we need to knock down as many barriers as we can. We estimate that, you get community immunity when around 70% of a population is vaccinated. Of course, children up to age 16 cannot be vaccinated at this point with COVID-19 vaccines. So it's really important that every adult who can, does get vaccinated. We're also leveraging private-public partnerships, for example, RTD and Lyft, to aid those folks that might have mobility challenges and have a hard time getting to a clinic. So we're trying to reduce transportation barriers. As Rick mentioned, really, it's about leaving no one behind. And then the department has done some formative research and created what I think has become a really wonderful COVID-19 vaccine education campaign. We call it Get the COVID-19 Vax Facts. We partnered with an agency to survey Coloradans and asked people, do they plan to get the vaccine? If there is any hesitancy, why? What messages would help encourage them to get the vaccine? And then who might the appropriate messengers be? And, one of the things we found out is that people of color, particularly in the Black and Hispanic communities, do have more vaccine hesitancy. And it's much more prevalent in women. And so Latino women, African American women, only 50% said that they were comfortable getting the vaccine. And so we're trying to promote that the vaccine is safe and effective. I want to show you an example of our campaign. It features some of Colorado's top medical professionals and health advocates from diverse backgrounds. We have commercials, we have influencers on social media, and we have local toolkits available that communities can use. But with that, let's quickly run the commercials. They are in both English and Spanish.
The COVID-19 vaccines have been proven safe and effective.
Got my sons, and I'm excited to see as soon as they're available.
As we get vaccinated, we'll all be closer to returning to the things we miss most. Remember hugging?
Getting together with friends.
Oh, nonsense, sure.
Get the vaccine fast.
So you're ready when it's your turn.
I think we have it in Spanish too. Here we go.
Se ha demostrado que las vacunas son seguras y efectivas.
Yo ya me la puse y me emociona y me tranquiliza que todos ya la podrán tener muy pronto.
Al vacunarnos estaremos más cerca de recuperar lo que extrañamos, como abrazar,
Repite con amigos.
conciertos,
Juntos podremos recuperar
obtener información confiable de las vacunas.
para que estés listo cuando sea tu turno.
So I just want to thank the team at the Department of Public Health and Environment. These health professionals are all on a task force called Champions for Vaccine Equity, and the department is using them to help get the word out to communities that vaccine is safe and effective.
Thank you, Jill. Thank you, Rick. And thanks to those who advise us on the equity efforts. The sooner we can get more vaccines from the federal government, the sooner we can save lives, end the pandemic. We're doing everything we can to get them out the door across the state. As soon as we get them in, it'll still take some time until everybody 70 and up gets the vaccine. But we know that Colorado has been and is in the very top tier of states when it comes to successfully administering the vaccine, getting it out. We're going to continue our leadership efforts on getting it out quickly across the entire state. And we can do this. Again, we must do this in Colorado. We're in the home stretch. We need to double down on avoiding social gatherings, wearing masks whenever we're around others, keeping a distance. Let's get through this, Colorado, and return to everything that we love with the global pandemic in the rearview mirror. Thank you. Happy to take some questions.
Hello, Governor. This is Vinny Darrell Chudice at Bloomberg News, Denver. For Colorado and other state governments, what is the current federal process for ordering and receiving second shots? And what can the White House now do to speed up the process for second doses? Thank you very much.
Well, I'm hopeful that the new administration gets under the hood and figures out where the doses are, how they can speed it up. And I encourage them to do that. I've seen, press releases from Pfizer that would indicate that they do have additional doses, that they need orders from the federal government to send out. I trust the incoming folks to really get every dose we have out into the field as soon as possible. We, of course, order doses for every Coloradan, 5.7 million people, or my instructions to the team order that many doses, but they don't have that many to send us every week through what they call the Tiberius system. They usually tell us on a Wednesday or Thursday, you can receive 78,000 doses, 83,000 doses, whatever it is. We then enter that into their system, and then we receive them on Monday or Tuesday of the following week. Occasionally, it rolls into Wednesday. So that's the way that system works. And any further questions on that, or did that answer your question? Vinny?
Thank you very much, sir.
Okay, next question. We're trying to allow follow-ups now. So that was the advice from our feedback from the media. So I'm going to say anything more. You're going to get another chance to follow up after your first question. Go ahead, next question.
Hi, Governor Polis, Claire Cleveland, CPR News. So from the state data that was shared with reporters earlier, it shows that COVID-19 vaccine has been given to whites disproportionately, including in the 70+ group. I'm just wondering, given the focus of your administration on these efforts, why is this disparity so stark?
Yeah, well, it's clearly unacceptable to have this kind of disparity here in Colorado, and that's why we're aggressively taking this on. That includes the vaccine resistance that we face in communities of color. You saw these new campaigns that are being launched. It also includes making sure that we're taking every step we can to be in community health clinics, to be in underserved communities with stand-up clinics through the equity effort, to make sure that everyone in Colorado, no matter their race, their heritage, where they live, has access to the life-saving vaccine. Follow up?
Yeah, I have another question. On Monday, you encouraged the release of these 40,000 second doses for the Blitz. Through Wednesday, data shows 37,284 doses injected in 3 days, which obviously when projected out would leave us short of the goal. Are you going to make it? And if you don't, does it raise concerns for you about your distribution network?
No, the state will distribute and use essentially every dose we have this week. With the data, there is a 72-hour lag period. So if there's a shot administered on Monday or Tuesday, it doesn't necessarily get entered into the system until up to 3 days later. So I would encourage everybody to look. So right now, here we are on Friday. We have the data for Monday and Tuesday, but Wednesday, Thursday, Friday data, and perhaps even Tuesday data is not finalized. So I'm very confident we could distribute 3 to 5 times the number of vaccines that we have. We could get them into arms this week. We have people that are ready to go if only they had the vaccine. Folks that say we're ready to do 1,000, 500, and they're only able to get 200 or 300. So we could absolutely get more vaccines into arms if we had them.
Great, thank you.
Hi, Governor. It's Jessica with the Denver Post. You previously said that the state strategy with drive-up vaccination sites or to do smaller sites rather than the mass drive-up sites, but we're seeing from under Biden's new plan that he would want to set up these mass sites with FEMA. Has the state strategy with that changed?
Well, we're for all of the above, Jessica, and I think you can look at what I said. We certainly haven't ruled out sites of any size. I think it's very important to have community-based providers because there's a barrier to traveling several hours or going to a large stadium or waiting in line. Every kind of site has a role. And whether it's a Coors Field site administered by UC Health, whether it's a FEMA site, we're happy to work with all partners on these kinds of sites. But the limiting factor is the amount of vaccine. And so if you only have so much vaccine, I do think it's very important to get it out into the community across our entire state rather than all at one site. That being said, in the population centers, if you have critical mass, you can certainly have a medium scale site or even a larger scale site as part of that overall model.
You have also, I think it was earlier this week, said that you have asked the Biden administration for more of a heads up when it comes to how many vaccine doses the state is going to get. Have you heard anything from the administration on if that's going to happen?
So that was we passed that along. We also passed along the need for quantity and the belief that some might be held back at the manufacturers. I know that they're just got in there. They're going to get to the bottom of this. We'll have some follow-up conversations with them next week. But we really hope that we're in a better place with regard to planning and reliability of dosage. And we will certainly keep you updated with any information we receive.
Thank you.
Governor Polis.
You've been watching You've been watching Governor Polis and the state health department giving an update on the state's response to COVID-19 and the vaccine rollout. Today, the governor gave a presentation. All hospitals, all the major hospitals in Colorado now have a place on their website, as well as a phone number to call for information on signing up for vaccines. That is for members as well.
Supply, it could even be sooner than
that hospital system. The governor also showed us today that he has a new equity task force tasked with making sure every Coloradan in the state has access to a vaccine.
Caregiver that might have to diagnose or administer the COVID test to all the kids who might have COVID, seasick kids, they're eligible along with other personnel. But yes, we moved teachers up from April-May timeframe to be at the very front of when we begin with essential workers after the most vulnerable and protected. Given the current supply estimates, the date is March 1st. We're hopeful if there's increased supply, it could be even sooner.
And Governor, for those folks who are getting their first vaccine now, what kind of guarantee can we give them that the second vaccine will be available in the appropriate?
Everybody who gets the first vaccine should set up that appointment for the second vaccine 21 or 28 days later. We will have that vaccine for that person at that time. If need be, in those future weeks, if we have to, we could even reduce the number of first vaccines available in those weeks to ensure that there were enough second vaccines. But we have enough reliability in the supply chain that we've moved to real-time management, which freed up the extra 40,000 doses for a total of about 120,000 first doses that can be distributed this week through Monday or Tuesday of next week.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado. Gobernador, ¿cómo garantiza usted que la vacuna del COVID-19 llegará a las minorías, especialmente a los hispanos? Y también, ¿qué puede decirnos sobre las pruebas de COVID-19 realizadas este mes de enero y que podrían haber dado un resultado falso?
Es una prioridad de mi administración que todos los coloradenses, sin embargo, tengan acceso a las vacunas. Por eso tenemos un plan para lograr esto en un equipo enfocado en ejecutar. Estamos distribuyéndolo en muchas clínicas de salud comunitarias, donde ir mucha de la comunidad latina, y quiero ser en los comunitarios en todas partes del estado para servir todos sin excepción. En cuanto a las pruebas de Curative, no tenemos razón para creer que esto afecta a Colorado, pero de todas maneras estaremos volviendo a hacer pruebas a las personas que fueron impactadas. Y estamos creando un plan para no seguir utilizando estas pruebas problemáticas en nuestro estado.
Hi, Governor. It's Mary Ann Goodland with Colorado Politics. I'm wondering, given that smaller counties might be getting a priority vaccines for their 70-plus folks a little sooner, we're wondering if Coloradans with second homes, if you've got a concern about Coloradans who have second homes in these less populated counties going elsewhere or going to these less populated counties to get their vaccines. You don't have a requirement that people submit a driver's license. And this also applies to people coming in from other states. We've seen some examples of that in Florida, where the Florida governor has said, if you don't live here, don't come down here to get a vaccine. What's your take on that?
So first of all, within our state, everybody 70 up is eligible no matter where they live. So there is no issue with somebody getting the vaccine where their second home is or driving half an hour to get it. They can get it. And it may be that you live in Lakewood, but the first appointment you get is in Thornton and you drive there and get it, and that's fine. You go from, you don't have to stick in your county. In fact, many people routinely go to caregivers in other counties, especially in densely populated metropolitan areas. So that is not an issue. If you're 70 and up, you can get it anywhere in our state. You can sign up at a provider that's convenient to you, or one that you are, or one that's not convenient. You know, wherever you want, you can sign up at the provider you choose, and then you will have the opportunity to get that vaccine. So with regard to out of state, we are not seeing a demonstrable impact of that. There are probably some Coloradans near the borders that go into other states, and likewise people in other states that might come into Colorado because they're the same zone in southwestern Colorado with New Mexico, and northern Colorado with Wyoming, eastern Colorado, Nebraska, and Kansas. But the truth of the matter is that every state is in about the same situation with regard to availability of the vaccine. So you're not likely to get it anywhere quicker anywhere else. nor are people from other states likely to get it quicker here. But I think the people around the border of our state routinely might go to medical services or other services in other states. Same with people on the other side of the border. And right now in Colorado, anybody age 70 and up is eligible. Some might be able to get it this week, some next week, some the week after. Soon, everybody over 70 who wants it will be able to have it. Our goal of 70% by the end of February also indicates that is, as you get north of 70%, you get folks that are a little bit more hesitant to get it. But we feel that there's at least 70% of people 70 and up that want it, and everybody who wants it will be able to get it by the end of February, hopefully sooner if supplies increase. Do you have a follow-up, Marianne?
I do, and this is on a different topic here. What's the status of vaccinations for that 70+ population in our correctional facilities?
We'll give you a update offline because my last information is a few days old, but over 220 people aged 70 and up have been offered that vaccination or have been given the vaccination in our vaccination system. I believe that's everybody 70 and up, but let's have our folks get back to you on that. But I know that 220 vaccines for people aged 70 and up have been administered in our correction system, and we'll get back to you on the specifics.
Thank you.
Hello, Governor and team. This is Faith Mangan with Fox News Channel. I believe this may be best aimed for Dr. Ryan, but Governor, of course, feel free to chime in as well. You've noted you're squeezing more doses out of vials, with the Biden administration working towards getting more syringes capable of doing the same. Can you explain in more detail how it works here, squeezing more out of each vial, how successful it's been? Are we already using the type of syringes the Biden administration wants to ramp up in production? Are they what's referred to as low dead volume syringes? And basically, simply put, how what we're doing compares to what the Biden administration wants to do.
Well, let me go to Jill in the specifics, but let me give the high-level guidance first. When the federal government tells us they're sending us a certain number of vaccines, we immediately translate that into what it means in Colorado on the ground. So if they're sending us 50,000 Pfizer vaccines, they say they're sending us 50,000. We call it 60,000, and we count it as 60,000 when we send it out. For Moderna, if they're sending us 50,000, it means 55,000. That's a 10% bump. 11 doses on a 10-dose style, 6 on a 5-dose style. We've heard informally that, in fact, the federal government is likely to move forward with actually changing the labeling to confirm the official presence of that 6th dose. We've heard on the ground that it is there when measured with precision. So we are holding all of our partners accountable for that. It doesn't mean that if one gets, on average 5.92 doses out of 6 on average, that's consistent with our guidance. But if there's a partner that's routinely getting 5 instead of 6 with the Pfizer, they need to change their practices, or we have to work with other providers. Jill, if you could get into any of that technical part, that would be great too.
Sure. Well, certainly, we want to be able to get that extra dose out of the vial, but as you all know, we also can't combine what's left over in the vials. You have to use the vaccine out of the same vials. In terms of syringes or other strategies to try to make the vaccine go further, we are working with the federal government to try and understand what's possible. They're talking about additional manufacturing or ways to use a second dose, assuming that the supply chain is there to be able to use that quicker for a first dose. So we're really looking at all strategies right now.
Dr. Ryan, did we acquire any special kind of syringe, or did we pick up anything just to make it better for us to do that?
And I'll just correct you by saying it's Director Ryan. I'm not a physician. And I will have to get back to you on if we got a new type of syringe.
That would also be a good question to give to our provider partners, to UC Health and Centura, and they ask them on their supply chains what they're doing in that regard as well.
Hi, Governor Dick Perry from the Sentinel calling. I was wondering, how will the state judge its progress in working with this hard-to-reach population, especially in the metro area and Aurora? Is there some type of a census or something saying, this is the goal of the people we want to get inoculations, and here's where we're at? And is that going to be dynamic as the state moves through that project?
Yeah, so 2 things. One is we have about a quarter of people that we don't have data on their race or ethnicity because it is self-reported. But we can go further than that by still being held accountable by extrapolating neighborhood level data about who's showing up. Those won't be perfect matches, but we, as he showed you with that map where we map income levels, we can also map diversity by zip code tract and make sure that we are reaching out to those communities. We can also encourage people to voluntarily supply information about their race or ethnicity, which we certainly plan to encourage our partners to do. And then to make this information part of the public dashboard, which I believe is going up today or tomorrow as part of the public dashboard, so that we're fully publicly accountable to delivering improvements on these results.
Okay. Also, thanks for allowing us to have follow-up questions. This is really helpful. I was wondering, this project, will this include people who are homeless and reaching these hard-to-serve populations?
Yeah, let me go to Rick on that. Certainly, everybody who's homeless is over age 70 is eligible today. Their race and ethnicity is tracked like everybody else. But we certainly, when we look at those pockets in those deserts, some of them might be areas that have a higher percentage of people experiencing homelessness. Rick?
Yeah, that's correct, Governor. We will be working with community partners, those especially in metro areas who have larger homeless populations, so that when we do pop-up clinics, we're able to capture those populations as well.
Thanks very much.
Good afternoon, this is Stephanie Rodriguez with Telemundo Denver. Hablando con miembros pues, de la comunidad latina hispana, me dicen que un enlace para registrarse es muy difícil, especialmente cuando no está disponible en su idioma. Ahora sé que pues, tendrán oportunidad de hablar por teléfono si optan no hacerlo por un enlace. Mi pregunta es, ¿estará esta información en español, el enlace en todos los proveedores y también los números de teléfono? O si tenemos como una meta de tenerlo disponible en español y también si se han discutido otros métodos para registrarse para la vacuna.
Sí, algunos de nuestros proveedores tienen operadoras en español y inglés y pueden hablar en los dos. Por ejemplo, UC Health puede llamarlos a 720-462-2255. Hay operadoras en español y inglés durante el día de trabajo. También puede llamar a Centura Health 303-436-7000. Los dos y todos son para personas más viejos de 70 años ahora, después más gente, pero ahora mayor que 70. Y también algunos de los sitios de red también hay translazada en español también. María van a correr a usted la lista que los resources en español.
Gracias.
One more question, I think. Is there one more question, Connor? Yes, go ahead.
Hi, this is Anusha with 9 News. We have been talking to some of the providers in rural Colorado who, like you had just mentioned, said that they have the capability to vaccinate more people than the number of vaccines they're getting every week. Beyond a county's population, what are the other factors that determine how many vaccines a county gets every week? And what do you say to some of the rural counties who feel like they are last in line to get doses to be able to move through their communities quickly?
Well, every provider we work with could administer more vaccine than they receive. So, I mean, you'll have the large systems saying we could do 2, 3, 4 times as many. Rural providers, our state as a whole could distribute 3 to 5 times as much vaccine with the current system without, and then it'll be even more if there's, FEMA pop-ups or large centers at Coors Field, et cetera. So there's simply a lack of vaccine, so it's going out slower because we're not receiving it from the federal government. As we indicated with the work that we've done, there's a higher percentage of folks in rural Colorado who have had the opportunity to be vaccinated by now, and that's a combination of the partnership with rural providers as well as the health equity efforts that have been done, some in urban areas like Aurora with Salute Health, but also in rural areas like the San Luis Valley and increasingly other areas, to make sure that everybody has equal access to this vaccine, no matter where you live in our great state. Did you have a follow-up?
No, thank you.
Did Rick or Jill want to tackle that one too? Rick, I think.
You know, I might just add that as we work with counties, you know, we've been able to do things like if a county says, if they're only do 300 vaccines, but they say we have a clinic set up and we could actually use 1,000, we will give them 1,000 one week, and then maybe the next week they don't get any, but at least it helps them have economies of scale. Also, we've talked to them about if they're able to vaccinate and meet some of our equity goals, then we can use the 10% and help subsidize what they're normally getting every week to help us with the equity goals throughout the state.
And I'll give one more example. Summit County, because they have a hospital, which is sort of the hub, has had greater success inoculating people over age 70 in Summit County. So they have 500 doses that they are now directing to the spokes, meaning outside of the county, to Lake County, to Grand County, and to Park County, to help get the people over 70 in neighboring counties who might not even have a hospital or provider in those counties. And if you're over 70, you might have difficulty driving across mountain passes in winter, to be able to have that vaccine closer to home. Thank you all so much for joining us. Stay safe, keep your distance, wear a mask. We'll get through this. Reach out to our press team so we can follow up with you if we weren't able to get to your question. And thank you.